Namaste, I am Dr.S.Jayaraman, consultant pulmonologist. I am the secretary of IMA AMS Tamil Nadu State Branch. Every year, in the month of February, so as per the WHO, we are conducting the World Cancer Day awareness activities for the general public as well as the practitioners. As a lung specialist point of view, lung cancer is the leading cause of morbidity and mortality in the world. Among the cancers, this is the number one cancer in the global scenario. If you take the Indian scenario, lung cancer is the third and fourth cause of morbidity and mortality. If you take the top 10 causes, lung cancer is the third leading cause of death in the men and fourth leading cause of death in the women. Such a common cancers. The etiology behind is, you all know well, tobacco smoking as well as the air pollution. 1/3 of the lung cancer patient, the presence of the lung symptoms, mainly cough, breathing issues, chest pain, hemoptysis, so these are the common symptoms, and sometimes weight loss and loss of appetite. And 1/3 of the patient, the presence with the advanced symptoms, mainly the metastatic symptoms. Suppose the metastatic lesion in the brain causing a seizure disorder, metastatic lesion in the liver can cause the jaundice, and the back pain due to the metastasis in the spine and bones and all. So there is no proper screening tool like CA breast and CA colon and CA cervix. So in lung cancer diagnosis, early lung cancer diagnosis, we have a low dose CT scan. The low dose CT scan help in defining any small cancers we can pick up. The indications of low dose CT scan for the lung cancer screening mainly for the risky group individuals. Those who are having the tobacco smoking habits, BD smoking habits more than 15-20 years without symptoms. Without symptoms, screening is very important. And risky group, risky occupations like industries like atomic, cadmium, nickel, chromium. So certain industries, risk factors, this is all the vulnerable group. And indoor and outdoor air pollution, those who are having a high exposure of the indoor pollutions, mainly the biofuel gas, and outdoor pollutions, mainly the diesel and petrol vehicle exhaust, can lead to the lung cancer incidence. So the lung cancer diagnosis, so we have to rely on the symptoms, radiological, and the biopsy findings. We have to assess the thing correctly and stage the cancers by doing the EBS bronchoscope and PET scan. Then we have a lot of treatment modalities, chemotherapy, radiotherapy, etc. So lung cancer screening is a very, very important thing. If you neglect the symptoms, lung symptoms like any cough, weight loss, so this will be the stage become operable, become to inoperable. So the lung cancer diagnosis is very, very important. In India, there is differential diagnosis wise pulmonary tuberculosis. TB and lung cancer symptomatology both are almost the same. The symptomatology of TB and lung cancer, cough, blood thin sputum, weight loss, loss of appetite, both are similar. So in the case of tuberculosis, sputum for microscopy is very important, sputum for AFB test and gene expert AFB very important. If there is no AFB in the stain pattern or a gene expert, rapid culture is negative, we have to go for the bronchoscopy test and take the phlegm out, bronchial wash and bronchial lavage, and confirm the diagnosis and start the treatment to prevent unnecessary morbidity, mortality because of the lung cancer. If it is lung cancer, the sputum test for AFB and gene expert all negative. So we have to go for the CT scan before bronchoscopy and take a bronchoscopy lavage and biopsy to clinch the diagnosis of lung cancer. So any stage of cancer, so treatable, curable. If the patient diagnosed early lung cancer, it's a complete curable. So muscle checkup is very important. Low dose CT scan is very important for the lung cancer diagnosis and management. So catch a patient early, diagnose early, treat early, so cure complete. So cure is not complete if you diagnose early. So this is the message. So we have to take it forward to create awareness among all the general population as well as the doctors. Thank you. Have a nice day.